totally empathise, because it is a very disabling and fatiguing condition. So yes, that's why I couldn't do it before today. So I'm very happy to be here, and thank you all for joining me. I hope you can all hear me okay. Just let me know if there's any problems. So because of that chest infection, I have a confession to make. I haven't done any movement since the 19th of December. So that's what, 2 weeks? And actually that's okay. And I get so many messages and emails and messages on social media from people who feel bad about not being able to exercise. Oh good, you can hear me, thank you for letting me know. Not being able to exercise maybe as often as they want, either because of fatigue, because of pain, because of flare-ups, because of illness. And they're worried that, not being able to exercise or move is going to contribute to deconditioning and, weakening of tissues. And I just want to reassure you that, today's theme is about what's normal. And, it's okay if there is a period when you're not able to do as much exercise or movement as you might want to. I certainly wanted to do my movement, but I physically couldn't. And so I listened to my body, and I've had lots of rest, lots of sleep, lots of chocolate. Today is my first day back, so I'm really excited to be moving with you guys. I'm so appreciative for everyone showing up today. Thank you so much. I hope you've all had a restful festive period. I know it can be quite chaotic as well. So at the end of today's class, we're going to do a lovely, gentle, grounding, calming session to really reconnect with ourselves again, because maybe you've been giving a lot to other people over the festive period, and today is all about coming back to ourselves. So thank you all for your lovely waves. Yes, I'm feeling much better. Thank you so much. I mean, New Year's Eve was spent in the hospital, getting some medications, some strong medications and inhalers for my chest. And many of you know my husband was also hospitalized during the pandemic with COVID pneumonia. So he also now suffers. So both of us were in the hospital getting medications for our chests. So we make a fine pair together. So today is all about what's normal. And as I said, normality for us, when you're living with a chronic illness, isn't going to be the same as everyone else. I look, and I used to look with envy at people who could go and do the gym every day and do stuff every day, and that just wasn't happening for me. And it might not be happening for you, and I don't want anyone feeling bad about that. The most important thing is that you listen to your body. The movement's always going to be there. The exercise is always going to be there. You can come back to it any time. And it's not like you're going to lose it overnight. I haven't done anything for 2 weeks. I can get back on my mat. Yeah, the first session I'm going to feel a little bit more fatigued. I'm going to feel it a little more, but I haven't lost what I had because it's in the bank. Okay, so please don't worry about these issues of flare-ups and things. The last thing we need is more stress and anxiety about the exercise. Remember, the most important thing is that we enjoy it, we feel safe, we look forward to it. So, of course, I was able to do my meditations, my breathing exercises, super important, especially when you're dealing with a lung condition. And many of you may also be suffering with breathing difficulties or lung conditions as part of your chronic illness. So, there are always things we can do. So I just wanted to mention that. And if you're new to exercise, maybe this is your first YouTube live with me, so welcome if it is. Or maybe, you're haven't exercised for a while. Many of us have had some bad exercise experiences. I wanted to share a little story with you that may hopefully inspire you and may help reassure you about your future exercise journey. So my sort of informed, let's call it informed, exercise journey, where I really started to learn about my body, about some awareness, about, control, proprioception, didn't start until I was 36. Okay, so gosh, almost 20 years ago, giving away my age, but 36 years old. So you might be younger than that, you might be older than that. When I was growing up, I didn't come from a very wealthy family. So while all my friends were off doing things like ballet, gymnastics, dance class, horse riding, doing all these things, even the Girl Guides, we couldn't afford for me to do that. So while all those things you might do in childhood, those things, dance, ballet, you learn some control, you learn how to move your body, you become more aware of your body, you're able to enjoy movement, hopefully, and you're much more conscious of how you hold yourself, you have more muscle tone. And so, I didn't do any of those things. So the only physical activity I had was at school, which was PE, physical education, once a week. And that's all I was doing. And of course, I was quite a good runner. I was quite a good cross-country runner. So that was my sort of physical activity, along with other things that you do in school. And of course, when I was about 15, I stopped running because I developed all these stretch marks all over my legs and all over my back. And I blamed the running. Of course, now I know that these stretch marks are part of EDS, but back then we didn't know. So I blamed the running, and I stopped running. I stopped exercising altogether. I resented everything about it because I felt that that's what had given me these horrible stretch marks on my legs and my back. So I stopped. Okay, and some of you may have been in that position. Maybe you didn't have a very active teenage, early adult life either. Now, I discovered yoga when I was 19 and I loved it. It was something I could do. I was pretty good at it. I was in pain all the time. Didn't know why, because I didn't have any body awareness. And I'll just make that clear. It wasn't the yoga that was the problem. It was me and my lack of control, awareness, etc. Probably strength and muscle tone, all of those things were causing me pain. Now, is it normal? Of course. For me, I just thought it's normal to be in pain when you're exercising. I just thought everyone hurt when they did yoga. When I started Pilates when I was 36, again, my neck would hurt, my hands would hurt with the weight bearing, everything would hurt, my back would hurt. Again, I just assumed that was normal to be in pain when you exercise. Now, just to clarify, it is definitely not normal to be in pain when you exercise. And that's why I obviously modified the Pilates into the integral movement method, because it suited my body more. So it's really important, I think, that that's not normal to be in pain when we exercise. We shouldn't be pushing through pain, I don't think. I don't think that works for us. I think it ramps up our nervous systems, makes us go into protection mode, makes us brace down and tighten up even more. So it's super important, as I've often said, that we feel safe when we're exercising, we're enjoying it, we're connected with our breath in a very gentle way, understanding how the breath facilitates movement and the movement facilitates breath. So, and I've obviously got loads of videos on here about breathing and things like that. So, no, it's not normal to be in pain when you're exercising. That's not to say it's not normal to have muscle pain after exercising. That's quite normal, and anyone would have that, yeah? But I'm not talking about pain that means that you can't move for, 10 days. Normal, a little bit of muscle soreness means you've actually done something, and that is a good thing, okay? But we shouldn't be experiencing severe pain when we're exercising. So in terms of normal, that's not normal, okay? Now, where did sort of this come from, this idea of normal today? When I did a post on range of motion, so many people commented and said, I have no idea what's normal in my hypermobile body. I just don't know. And I thought that's a really good point, because a bit like me, who didn't have any training or any help with learning body awareness, I didn't know what was normal either. I thought pain was normal. I probably was having really excessive ranges of motion as well when I was doing certain things. So if you don't know, you don't know. And it's not your fault, it's because that is our normal. Okay, so it's not that we're doing something wrong, it's just that we weren't aware of another way of doing things. And so what I found over the years is that improving control, improving proprioception, improving alignment, improving my awareness really helped reduce my pain. And as you know, I reduce range of motion quite a bit. And that was the only way I could really understand what was normal. And that's what we're going to be doing today, is actually reducing our range of motion. Because if you don't know how to control a range of motion, going end of range isn't really going to help you, because that's what you've always done. And if you don't know how to control yourself or your body against gravity, against external forces, against weights, etc., then you just won't know how to control it. You've never experienced it. So that's what we're going to try and do today. So my point was, I started my journey at 36, which is, you know, not old, not young, but that's how my journey panned out. So if you're watching this and you're just starting your journey, and you know, maybe you're a similar age, maybe you're older, maybe you're young, it doesn't really matter. But my point is, it doesn't matter. There is no age restriction or limit as to when you can start working on this. I've got clients who are 70, 80, and they're still enjoying movement. So please don't be put off and think, oh, it's too late for me, my body's too deconditioned, I can't do anything. You absolutely can. I was in a terrible, terrible state when I started. And obviously I went on and trained, and I learned and examined all different types of movement and really delved deep into this. And that's what I'm here to do, is to help educate us so that we can benefit from that experience that I went through. So there is no limits to when you start, so please don't ever let that put you off. And you know, even if you're starting from the bed or you're starting from your chair, that's absolutely fine. I'm a great believer in there's always something we can do. Okay, it's not that things are ruled out for anybody. Everything is accessible for everybody. Okay, so let me just check my notes. So yeah, so if we're doing stuff that does cause us pain, as I experienced, yoga, Pilates was really causing me pain, maybe that's not the best normal for me or you. So if it's causing me pain, if it's causing me subluxations, if it's causing me anxiety, if it's causing me stress, then maybe I can modify that to make it more pleasurable and less threatening to my nervous system. Okay, so it may be that today we don't know what our normal is. Hopefully by the end of today you'll have a better idea of how to achieve maybe changing some of your movement patterns. It's obviously a process, it's not going to happen just like that, but hopefully you'll get some little tidbits to help you. And the other thing I wanted to touch on, and we're going to do that in a minute, is neutral pelvis. So again, I think I did a post on, it was on the myths, because some people have been told to keep their pelvises in neutral when they walk. So a neutral pelvis is obviously perfectly aligned. You've got 3 bones, you've got your 2 hip bones and your pubic bone, kind of form a triangle, and that triangle should be facing forward. I shouldn't say should. If you're trying to achieve a neutral pelvis, people will say this triangle should be facing forward, or if you're lying down, should be facing the ceiling, okay? And as I said in that myth, if you look at my videos, I do have a slight anterior tilt of my pelvis, despite almost 20 years of movement therapy. That's just how I am. And me trying to fix it and force it back into this perfect neutral position probably isn't ever going to happen unless I want to create more tension in my lower back, which I don't. So, neutral pelvis. We're going to look at that. I'm going to get you all to do a little experiment in a minute. But neutral pelvis does not exist in motion, as in walking, as in gait. Okay? Do you know who has a neutral pelvis when they walk? Ken and Barbie. Ken and Barbie. And I'm not talking about the film. I'm not talking about, Margot Robbie and Ryan Gosling. I'm talking about the dolls. Barbie dolls. So if you look at a doll, it has its torso and it has its legs attached to the torso, and you move the legs, don't you, independently of the torso. So their pelvis, sort of pelvis, which is attached to their torso, doesn't move. So their legs move like sort of matchstick men, don't they? If that's what we want, that's a neutral pelvis when you walk. If we're supposed to walk like Barbie dolls, or Ken dolls, that's what a neutral pelvis would look like, with zero movement in the pelvis. Okay, now that doesn't look or seem very functional or normal to me. And as I explained in the myth video about this, the pelvis is designed to do lots of things when we walk. It's actually going to tilt forward, it's going to rotate a little bit, it's going to hike a little bit. It needs to do lots of different things. So how can we hold that in a neutral position? And the same applies when we're lying down. And I'm going to talk you through my thoughts on a neutral pelvis. We'll do it as an experimental thing rather than me talking to you. It's much easier to do. Sorry, I can't read the comments, but hopefully I can read them later. So let's just try something together. You won't be able to see me. Probably not all of me, it doesn't really matter. If you're able to stand and you're happy to stand, we're going to go ahead and stand. If you don't want to, that's fine, you can just watch and observe. So obviously look after yourselves as always. We're just going to do this little experiment on neutral pelvis. So actually you can see me, and you can see my little anterior tilt of my pelvis. Look, my triangle is not facing directly forward. Okay, so I can make it tilt forward by forcing my pelvis back. So look, my hips are slightly forward and the pubic bone is slightly down. Now I could create a neutral pelvis by doing this, by tucking my tail and pulling the pubic bone up. And now I've got a neutral pelvis. But what I also experience is quite a lot of bracing and tension around my abdomen and a little bit of tightness in my lower back. But if you want a neutral pelvis, I've done it. Okay, and then of course we're expected to move in this neutral pelvis. Now that feels really challenging to me because I feel quite stuck and rigid in this position. So I don't particularly like it. So I'm just going to relax, because that's an awful lot of hard work, and that's one of the things I have issue with, is that if people are trying to force us into these positions, that's just loading us with more tension, okay, that maybe we've already got in our bodies. Okay, I'm not saying a neutral pelvis isn't important, but how you get to your neutral pelvis is probably more important. And some people, like me, have this natural position. Now, I'm not talking about something like this, where I'm clearly hyperextended, okay, and that may be not very functional. Okay, it might be causing a lot of tension around here in the lower back, in the abdominal muscles. But again, even if someone presents to me like this, I'm not going to force them into a neutral pelvis. That's just going to cause them more pain. It doesn't make sense. Anyway, forget all of that for now. Let's stand hip distance apart, and let's just do our little rock and sway. So a gentle left to right, so that you're balanced on your left and your right foot. And if you can, a gentle sway forward and back. So you're balanced on your heels and on the balls of your feet. Okay, so the best of your ability to find center. Okay, and then you can put your hands on your hips, okay, and just kind of get a sense of where you think those hip bones are pointing. So are they pointing up? You might have a posterior tilt. You might be pointing up. Maybe you're pointing down, maybe you're pointing straight ahead, which, just notice where you are, but keep your hands on your hips. And then if you're able to, I just want you to take a step forward. Just take a step forward. And guess what? Your neutral pelvis is no longer there, because your pelvis has shifted. So if you watch what happens, I take a step forward, my one hip's gone down, one hip's gone up, and my pelvis is rotated slightly. Is that still a neutral pelvis? It's certainly not fixed, but if I try and fix it, this is what it would look like. So am I trying to walk like this? It's really hard. I can feel so much tension here. I can't breathe. So as I said, as I step forward, the pelvis is going to shift over the weight-bearing leg because I'm about to take this other leg off. So if I haven't shifted the weight of the pelvis over this leg, I'm basically going to have to pick up that leg to walk. If I'm trying to keep a neutral pelvis, I've got to pick up that leg, and that is really going to irritate these hip flexors, okay? Not to mention the diaphragm, and not to mention everything. So as I take a step forward, my pelvis shifts and it tips and my hips rotate a little bit. And now I've got enough weight in my front leg to pick the other leg up and take a step forward, and then the process starts again. Okay, so just have a little play with that and just assess how that feels. And obviously look after yourselves, don't strain anything, but how easy is it for you to keep a neutral pelvis when you walk? Virtually impossible if you want fluid movement and good gait mechanics, okay? So I've had a few questions about the neutral pelvis in supine, which we're going to do now together, and that people maybe when they lie down don't have this neutral pelvis, but being forced into a neutral pelvis to do exercise. And again, any kind of forcing and fixing is going to put tension in that person's body and might not be conducive for exercise. But we're going to try this now together. So come back to your mat. Now what you'll need for today, if you've got it, is a ball. If you don't have a ball, you could use a cushion and a TheraBand of some kind. Again, if you don't have these things, don't worry, but they're just really, really useful for helping with proprioception and control, which is what we were talking about what's normal, okay? So far in terms of normal, it's normal to not maybe be able to do exercise every single day like other people. That's okay, okay? We don't want to be beating ourselves up. And it's not normal to have pain when you exercise, like acute, horrible pain, pushing through pain. Personally, I don't think that ever works for us. I just think that causes us more anxiety. And then in terms of normal, in terms of range of motion, that's what we're going to look at now, okay? So we're going to, I'm probably going to have to move my phone down, sorry. Just one moment. We're going to get on the floor. If you need head support, obviously grab that. Make yourselves comfortable. As always, don't do anything you shouldn't be doing. If something doesn't feel right for you, please don't do it. Please look after yourselves. And then we're going to stay on the floor and do some lovely relaxation at the end. So I'm going to have to move, excuse me, because my phone fell off the stand. But hopefully, yeah, you can see me. Just bear with me. If you get yourselves organised. There we go. Yeah, there we go. So hopefully you can see me. And if you go ahead and lie down on your back with head support, have your band nearby, have your ball near your feet, okay, because we're going to use that on our legs, okay. So hopefully you can see my pelvis, which is the most important thing right now, okay. I really don't like this vertical orientation that YouTube, I used to be able to do them portrait and YouTube has decided to change it. So you can't see all of me, which I don't particularly like. Anyway, here we are today in our position. So let's just talk neutral pelvis for a moment. So if I lie down and my pelvis naturally is like this, okay, I've got a big arch. You can get your hand under my back, and this is how I'm presenting myself. Again, the triangle is not facing the ceiling, the triangle is now facing the other side of the room. Okay, so if somebody presents like this, if you're presenting like this, forcing you to come back into that neutral position and then ask you to exercise is probably not the best thing to be doing, okay? So you just lie there and kind of settle yourselves in and get a sense of where your pelvis is. So let's just take a few breaths and just take a moment to notice where the pelvis is, okay? So maybe it's tipped backwards, maybe your back's very flat, Maybe it's hyperextended the other way. Maybe it is just resting in a comfortable position. So my point is that if somebody is very tipped forward or tipped back, and we force them into this perfect neutral pelvis on day one, yeah, their body may not be ready for that. They're going to be fixing in order to do that, which means tension. Fixing means tension. So if we're fixed in a position to do an exercise, is that the best way for our hypermobile bodies to be treated? Okay, I don't think so. So what we want to do, so you can rest your hands on your pelvis, okay, and we're just going to take a few breaths. So even if you are here in this hyperextended position, just let yourself settle, okay, whatever that means to you. Okay, I don't want you to be thinking about this perfect position. I just want you to take a few breaths, and as you exhale, let the weight of your body start to soften down towards the ground. So can you start to feel the sort of the pull of gravity as you exhale? Now remember, if you've got a very hyperextended back, your back muscles here are probably going to be quite tight. So if you feel them, they might feel quite tight, they might feel quite sore, okay? Their tightness is happening because the pelvis is being pulled forward, okay? Now, if I just force that back, those muscles don't have the opportunity to soften and lengthen. So what we're trying to do is allow this area to soften and lengthen in its own time. Okay, and that might be different for every single person. But the most important thing is that when you're starting to exercise in this supine position, is that your pelvis feels comfortable and that you can actually feel the weight of your own pelvis on the floor. So if you take a breath and then just let your breath settle, really focus your attention on the weight of the pelvis. And can you give your pelvis to gravity? Can you give your pelvis to the ground? So that the muscles around the pelvis, the hip flexors, the abdominal muscles, the glutes, they can actually rest for a moment. Okay, so the front of our thighs here should feel quite soft. Okay, and that might not be the case today, and that's fine. Okay, now from this position, of wherever that is for you, can we think about just lifting a heel off the ground and then floating the leg up into a knee roll? Okay, so I've just lifted, just shuffle back a bit. I've just lifted the leg up, okay? And then putting it back down. Now my main interest is the weight of my pelvis and the ability of my pelvis to absorb the weight of my leg, okay? If I was fixated on the neutral pelvis and holding it in place, this is going to be a very different movement, quite tension-led, okay? So what we want to do is really let your pelvis rest, a bit like this ball. Let the pelvis rest on the ground. The heavier your pelvis feels, the more stable your pelvis is going to be. So let it rest and then let the movement happen around this very stable, fluid organism, rather than something that's fixed and rigid that we then try and load. Because if I fix this, and you can see how the tension is in this ball, if I fix this and then I load it with movement, where's that tension going to go? It's kind of stuck. It's not going to dissipate through the whole structure. It's going to be stuck, okay? And if it's stuck, then it's going to probably start to cause us some pain. If I'm loading my pelvis with a leg lift, with whatever it is I'm doing, I need to spread that load, a bit like with our gait. If I keep my pelvis in a neutral position, I can't spread the load of my torso as it moves over one leg and the other. Okay, hopefully that makes sense. So keeping your pelvis nice and heavy, so that's a constant, yes, keeping the weight in the pelvis. And if you've done any of my classes on here, you'll know I always go on about the weight of the pelvis. And I want you to take your band, and you can double it up if you want. We're not going to be pulling on it. We're just going to have that across our belly. Pelvis is really heavy. And then you're just going to take a breath. Let your pelvis settle. And then talking about range of motion. So if my arms can normally go all the way to the floor and I don't feel anything and I just collapse to the floor, that hasn't got good shoulder control, good shoulder mechanics. So using a band can help us understand and sense a little bit more our shoulder control. So feel the weight of the pelvis, let it settle wherever that is for you. There's no perfect position, we're all different. And then you're just going to let the weight of the back of the body float the arms up, so the arms are just above you. And let the shoulders really feel heavy into the mat. And then from there, we're just going to go a little bit further behind. Sorry, I really hate this new setup of the phone, sorry. Okay, so even if I can go all the way to the floor, I'm not going to, okay, because I want to go to a point where I feel I'm actually having to do some work. And then I'm going to bring the arms all the way back, very slowly, okay? So if I don't go slowly, I'm just collapsing into gravity. Somebody asked me on one of my videos, what does that look like if I don't resist gravity? It looks like this. If I don't resist gravity, it looks like this. It looks like this. Yeah, what we've got to try and do is resist gravity, so that our stabilizing muscles and our eccentric control can improve, okay? So let's do one more with our band. Really focus more on the weight of the back of the body and how heavy you feel, how your breath can settle in the back of the body, and then go to where you can without losing any weight from the back of your body. And then bring the arms back, resisting gravity. Soft elbows, of course. And then all the way back. Good. Now, grab your ball, which is hopefully by your feet. And you're going to put I'm just going to do it here so you can see. You're lying down and you're going to put one foot on the ball. Okay, so it's a wobbly surface, of course. But if I'm used to hyperextending my knees all the time when I stand or when I do an exercise, and hyperextending knees is my normal, how can I learn to control that? Well, this is quite a nice way of learning to control that. So again, if I don't resist gravity, I'm just going to plop into the floor. No controller, bouncy, nothing going on there. If I can send my leg away, so rolling the back of the leg away very slowly without dropping into hyperextension at the end, I'm learning some new normal, okay? And then how do I get back? Well, back to the heavy pelvis. The heaviness of your pelvis causes the knee to bend and the leg to come back. Okay, so it's not this and pulling on my knee. You can see I've got no control here whatsoever. It's about moving from this weighted pelvis, allowing the leg to come out of the pelvis, and then the pelvis drawing the leg back in. And notice how slowly I'm going. You don't have to sit up, by the way. I'm just showing you so I can see what I'm doing. And you can see a bit more of me. Okay, so see how that feels? If you can't fully extend your leg and you're only going to here, that's fine. Let's swap legs. Because what you might find if you're very tight here is that when you try and straighten your leg, your back arches even more, okay? So keep it within a range that you can control. Just get my leg out of the way. So remember, how do I get my leg back? I get my leg back because the pelvis expands. The weight of it draws the leg back. It's not about your hip flexors pulling it in and out. Yes, the hip flexors are working, but they're not working on their own. And is that the reason so many of us have such tight hip flexors? Is because they're overworking and the guys at the back are not doing anything at all. So can we balance it out so that everyone is helping bring the ball back? And they're drawn in towards the weight of my pelvis, whether it's neutral or not. And you know, if you are somebody who has a very anterior tilt, the more you focus on the weight and the softening, your anterior tilt is going to start to change. It's going to drop back, okay? But forcing it is not the answer. So being fixed to try and do this stuff is going to make it incredibly, incredibly difficult, which we don't want, obviously. So hopefully you had a little play with the ball. Now, grab your band and tie your band. This one's a bit of a faff, sorry. Tie your band around your thighs. Just double knot it. You want it quite tight, but not enough, obviously, to hurt yourself. And again, what I see a lot of course, with our hypermobile hips is a lack of hip rotational control. So when I ask somebody to do a knee drop, which is when we take the leg out to the side, the legs can literally flop to the side. Again, zero resistance of gravity. We're just flopping, because that's been our normal. We didn't know that we were meant to be resisting gravity to have greater control and awareness and proprioception and less pain. But if I'm constantly flopping out to the side, how much do you think these muscles are actually working? They're probably not, because they're just plopping. Plopping, is that a good word? Plopping to the side? Dropping, plopping to the side, yeah? So we want to learn this new normal of actually having some control, she says as she's sitting here with her locked elbows, so soft elbows as well. So let's lie down. Sorry, you can only see my legs. So I've got the band because it's going to give me a little bit of resistance against gravity. So what comes first? Pelvis. Let's breathe into our pelvis. Let it settle. Let those back muscles soften. Find the heaviness. And from that heavy place, start to move one leg out to the side. Now, the other leg might want to come with you. Obviously, that's not allowed to happen because the pelvis should be so heavy, this other leg doesn't move. And then slowly bring it back, resisting the band, which is going to try and pull you back. Okay, so let's go to the other side. Heavy pelvis. That's the most important thing. Can I keep a heavy pelvis? And can I resist gravity and resist the band as I'm coming back? So it looks, again, I'm just sitting up so you can see. So I'm resisting on the way out, and I'm resisting on the way in, and I'm still breathing, and my pelvis is still heavy. And then I'm resisting, and I'm resisting. Okay, so I'm not just doing this. Can you see that there's no control here? Yeah, I'm going to injure myself. Yeah, I need to reduce injury. We need to improve control, awareness, proprioception. Okay, and then we start to get to those stabilizing muscles. And when you get to the stabilizing muscles, we start to feel a lot more connected. Okay, this is why the IMM has a certain pathway. Breath and relaxation, followed by proprioception. then followed by more challenging things in stability, okay, and then coming up to balance, etc. Okay, so there's a reasoning for it. Now, let's just slide the band off. I don't know how we're doing for time, but thank you for staying with me. Yeah, we're going to carry on. Let's come over onto all fours. Again, is it normal? For me, it was definitely normal in the old days to lock those elbows, and you can see what that does to my shoulders. Soft elbows, locked elbows, soft elbows, locked elbows, and my head would be falling off here. And because I've locked my elbows, can't really see, but yeah, I've lost the fluidity, and now I've got an awful lot of pressure going through my wrist. So I get so many questions and emails about my wrists hurt when I weight bear. And mine used to hurt. I used to hate it because they used to hurt so much because I was like this. So all the weight was going down into my wrists. There was nothing resisting gravity, including my head, which was falling off. And you can see the shape of my lower back. I was totally collapsed. And where's the pressure going to go? It's going to go through the bit that's touching the floor, which was my poor old wrists. So we have to soften the elbows first of all and learn to resist gravity. Now, I didn't do that by pushing. I did that by lifting my spine. So have a little play with that. If you're somebody who hyperextends and your wrists hurt, start by softening the elbows. Yeah, and then lifting away from gravity. Now that means you're going to be doing some work in your spinal muscles, and that's okay. That's a good thing. Okay, now from there, with soft elbows, can we go into our cat? So if I'm a hyperextended person, this might be my starting position. Okay, so from this starting position, can I still learn to tuck and round my pelvis? Okay, now, if I don't resist gravity as I come back, I'm just going to collapse into that. Okay, so once you're in your cat, can you resist gravity to come out of it? Gravity is such a big player in our movement quality, in our movement, our control. So can you resist on the way out rather than collapsing? Yeah. So I don't often teach cat-cow. So this is cat. Cow is when we go into extension. And the reason I don't teach it is because so many people can't control it, me included initially. I would just collapse into it and then I'd throw my head back, which was really bad on my neck. Because I have a hypermobile neck, I could just throw it around. So I don't have an aversion to cat-cow, but I'd like to see it done with control and proper articulation. So that's why you don't see me doing many cat-cows, mainly doing cats. But if you can start to really articulate into extension, then that's great. There's nothing wrong with cat-cow, but I just don't see it performed very well because so many of us have this tight thoracic spine and very mobile necks and lower backs. So I just find it causes too much pain and discomfort for people. So now, while we're upright, whether you're sitting on a chair or sitting on the floor, where's neutral in a seated position? So is it here? Can you see I'm now tilted forward? Or is it here where I'm now tilted back and I'm slouched? Okay, so this is sort of a, used to be my go-to position. I could kind of hang out here for most of the day. Always had back pain, shoulder pain. And can you see why? Because all these muscles are being stretched without any resistance to gravity. I'm just falling into gravity. So let's just see if we can do our pelvic tilts in a seated position. Can we tip forward? And only focus on the weight of the pelvis. So can you find your heavy pelvis and then tilt it forward and back? And it comes from these guys, the sitting bones. Can you feel the weight of your pelvis? It's not this. Can you see that's just me moving at my lower back, a bit higher up? I want to move down here. Look how much smaller it is, but it's coming from my pelvis. Okay? So again, it's not about fixing a neutral pelvis and a perfect spine. That's not going to last. You're just fixing it. It's going to be very tiring. It's going to be very painful. So what we want to do is, if we can find the weight of our pelvis and let the pelvis settle, the spine is going to find freedom from the weight of the pelvis. Very similar to what we were doing lying down. So this pelvis is so important to the movement of everything else, but please don't go and fix your pelvis into a certain position, because that's going to create more tension and bracing and probably lack of movement. Okay? I know for sure it causes pain because I see it time and time again in the clinic when people have been told to fix into neutral. But when we start to teach them how to find that beautiful weightiness of the pelvis, their pain goes away. Okay, so fluidity isn't going to come from fixing a pelvis. So I hope that was helpful. Now what we're going to do, if you'd like to, we're just going to spend a few minutes just connecting with ourselves again, because as I said, the festive season, maybe you've had family, friends, visiting people, traveling, it can take a lot out of you. And actually I would just want, me included, because I was obviously sick over the holidays, so I really want to just give myself some nourishment. So I invite you to come down onto the floor, and again, just get yourself comfy. If you want a blanket as well, and just really cozy up for a moment. We're just going to spend a few minutes here. I might sit actually, so then I can see you. And you guys go ahead and lie down. If you want to do it seated, that's absolutely fine. So once you're settled, I'm going to invite you to close your eyes. Just shut out the rest of the world for a moment. Close your eyes and let them close softly, and let your eyeballs soften and let your jaw soften. Just get rid of any tension around the facial muscles. Soften the base of the tongue. And again, just come back to your breath. So just take a few breaths without trying to change it, without trying to fix it. Just be with your breath right now. And we were talking, weren't we, about the weight of the pelvis. So as you lie here, can you feel and connect with the weight of your pelvis? So one of the best ways, if you're feeling stressed, anxious, and of course, this doesn't always apply if you're struggling with trauma as well. I understand that sometimes these practices may not be suitable, so please look after yourself. But feeling your own body weight into the ground for a moment. Whatever is touching the ground, whether you're sitting or lying down, whatever is touching the ground, can you breathe into that? Into that space, wherever that is. And really give yourself to the ground. So feeling the contact points, because your body touching the surface of the mat or the bed or the chair, feeling your own body weight is your sense of self. Feeling your body weight is who you are. That is your physical structure. So I want you to feel that and breathe it and notice it. Don't judge it. And again, sometimes, some emotions can come up when we start to actually let go, to give in a little bit, to take down some of those protective barriers that we have, and actually letting ourselves settle into the floor. and giving into gravity. So if you feel, eyes watering a little bit, that's normal. That's perfectly normal. So again, just feeling it, noticing it. And imagine how the bones are settling within the connective tissue into the ground. And see if you can allow that to happen. Invite your bones to just soften within their little connective tissue sleeves. Yeah, they're all encased in their little connective tissue pockets. Can we let them soften? And just take a moment to just be with that, to be with your physical body, and really notice every contact point that you're making on the ground or on the chair. And just breathe into it. And the more we do that, the heart rate might start to slow down. But the more we do this, the quieter the mind becomes. So you might have been rushing around looking after other people, or you might have just had lots of people in your house, and that can be very stressful when you just want some peace and quiet. And so allowing the mind to just be quiet for a moment, it's almost like we soften the mind as well as softening the body. So you've got more space in your mind. It can be very nurturing. So just appreciating, and it's okay to want this. It's okay to want the quiet. It's in fact very healthy for us to have time during the day where we're just quiet without all the noise and the thoughts and everything going on. So just take a couple of more conscious breaths, sort of a deep, obviously don't go crazy, but a deeper breath. Just be really present. Feel the body expand as you inhale. And feel it soften as you exhale. Again, 2 more conscious breaths. Inhale. Exhale, soften. Quietly. Still a quiet breath, even though it's a conscious breath. One more time. Inhale. And exhale. Good. And then when you're ready, if you had your eyes closed, just softly allow the eyes to open, but stay where you are. So come back into your room, notice the surroundings, notice your mat. Maybe you've got noise outside, it's pouring with rain here, so I hope you didn't disturb you too much, but notice any sounds outside. And just gently ease yourself back into today. And just maybe wiggle your fingers and toes, moving your physical body. Very nice. Now you may want to stay there and just enjoy that peace for a few moments. Or you may want to make your way up to sitting. I'm just going to move my phone again. Sorry about the camera angle. So yeah, thank you for being with me. We've been here nearly an hour. So thank you for staying with me. Gosh, loads and loads of people here. I really appreciate it. If you've got any questions, please put them in the comments, and I will get back to you. But I hope you enjoyed that. So we basically covered what's normal, different aspects of normal. Yeah, and is there a normal for hypermobility? I think, we are what we are, and as long as things don't hurt us and we're comfortable and we don't feel unsafe, and we can do all the things we want to do, then maybe that's our normal. But if things start to cause us pain and subluxations and things like that, then maybe we can change our normal. And as I said earlier, my journey didn't start till I was 36. it's never too late to change your normal. Never, ever too late. Never too late to work on these things. So please don't ever feel disheartened or too deconditioned, because it's just not the case. It's just not the case. I was one of the most deconditioned people you could ever meet, with zero body awareness. And I've come to love this. I've come to love exploring the body. I've come to love sharing this with you. So I hope you found it useful. And of course, we spent a lot of time talking about neutral pelvis and whether that is, the secret to pain-free movement. And personally, I don't think it is. Not if it means you've got to be fixed and pushed into a neutral pelvis. If you can find a neutral pelvis by allowing the body to settle into a neutral pelvis, and that might take time, okay? If you're very, very tense and fixed in a certain brace position, that might take time. But you can't force these things. You definitely can't force the pelvis to do something it doesn't want to do without expecting some discomfort, in my experience, and my personal experience, not just my clinical experience. So yeah, neutral pelvis does not exist in motion. It might exist in supine positions, in other positions, which is great, as long as we're not forcing ourselves into that position, okay? And yeah, then just spending some time with ourselves, just to set ourselves up for the coming year. So loved being with you. Thank you for all the lovely comments. So nice. Thank you. I'm so glad you enjoyed it. The last live session we did was 7 months ago. So back in the May, when it was May Awareness Month. So I'm really hoping to come back and do some more live sessions. I really enjoy doing them. So we'll probably go back to doing them on a monthly basis. If you can join me, I would be super happy to see you and all your lovely faces and all your lovely comments. So I will leave you in peace. Thank you so much for joining me. Enjoy the rest of your day, your evening, your morning. I know we've got people all over the world tuning in, which is fabulous. And yeah, if you've got any comments, any questions, pop them in the box below and I will definitely get back to you. And I will see you again very soon. Thank you for joining me and Happy New Year. And here's to a pain-free, movement-filled 2024. Take care, everyone. Bye-bye.